All right, let's call the meeting to order.
You're up. Not here.
Please rise, stand up all heart. Face the flag, pledge allegiance to the flag of the United States of America. To the republic which stands one nation, under God, indivisible, with liberty and justice for all. Do a moment of silence for the members serving overseas.
Great.
Do we have a, want to get the roll call?
Yes.
You know, it's good one.
Thomas Devaney,
Present.
Frank DeBogus. Present. David Caldors, present. Charles Mackey is excused. Lisa Line Gross. Christopher Airy. Scott Kittegrad here. James Jamian.
Present.
Barry Rigney.
Yeah.
Tracy Avamont.
Here.
Todd Haken.
Present.
Thomas Durfee.
Here.
Keith Wilkin.
Here.
Donald Hudson.
Here.
Steve Orlando was excused. Ed Waldron. Frank Chester. Mark Frappier. Neil Velasco.
Here.
Karen Brom. Suzanne Besman. Yesenia Nia Williams. Andy Simone. Dr. Tamara Bloom. Rob Finio.
Here.
Dr. Berrios is excused. Deanna Ripley. Dr. Alan Shearson.
Here.
Jennifer Mandel. Michael Schwartz. Matthew O'Connor. Robert McAvoy.
Here.
Dana Cortapasso. Mary Beth Fraser.
She's here.
She's here, okay. Kevin O'Hara.
Here.
Alina Nix.
Here.
Dr. Victor Politi.
Present.
Okay, we have a quorum.
All right, great. So we have a motion to approve previous meeting minutes. Motion, Dr. Pearson, second. Nina, all in favor? Aye. Any opposed? All right, moving right along. There have been no Department of Health disciplinary actions since our last meeting. So it's just a good thing on our part. My report, I just want to announce that we have a Mary here is our new ED nurse manager. Represent. And we have a new backseat person and a new alternate, but a backseat. So I don't know if is the back person here. Oh, there you go. And the alternate is Greg. It's not yet. All right. And we have a new membership chair. Thank you, Alina Nix, for stepping up. So that's everything going forward. Mr. Vice Chairman, you got a report?
Yes. Well, wait for the regular committee report. The it was the the awards doesn't have its own committee, but it does.
Public education.
Okay, I'll do that under that one.
Yep.
Okay. Otherwise, where do we need to go?
All right. Secretary Treasurer, Mr. Caldor.
I have no report. The books are at the account.
Don stepped out for a second. We'll go back to him. The audit committee, program agency contract was executed. REMSCO budget was submitted and signed. REMAC. Yeah.
Hey, everybody. So first off, if everyone noticed, there's the DEA has new regulations out regarding controlled substances. New York State Bureau of Narcotics Enforcement has advised that everything is status quo in New York for now. They are working it out with the DEA if there needs to be any changes. So as of right now, everyone just continues doing what they're doing with their controlled substances. If any questions come up, just refer them to B&E. So that's the first thing. The second, there was some confusion regarding cameras in EMS vehicles. The new Part 800 and Article 30 guidelines that came out do state that starting in October, EASDs, which are fly cars, are going to require cameras, but it's only new vehicles that are being approved by the state, and it's only for EASVs. It is not for ambulances. So there was a news article that came out that said it was ambulances, and then a million emails and everything in confusion. So just to clarify that, it's October, it's EASVs only, and it's only new vehicles. If any further questions, you should just look into that. The new Part 800 guidelines are currently in effect. They went into effect at the end of April. If there's any questions, let us know. But the new Part 800 guidelines for equipment in both ambulances and BLS FRs and ALS FRs is in effect. And then finally, one of the things to vote on later coming from the REMAC is the Long Beach freestanding ER guidelines. In the original policy manual from Nassau County, it was in there, and then when we adopted the collaborative protocols, somehow it fell out of the manual. So we just revisited from the REMAC. It's exactly the same as it was. We're just reissuing it back in the manual to clarify that. So that'll come up, I guess, from REMAC for vote during the new business. But it's exactly the same as it was before, and it's just to clarify to make sure that the right patients are getting to the right places. Back to you, Mr. Chairman.
All right, thank you. We'll just go back to Semsco rep, EMS coordinator, Don Hudson.
Sorry to step out, take a while. So last 8 meetings were canceled due to the blizzard. Hopefully next week's meetings will not be canceled. There's no blizzard. So next 8 meetings are next week, and I'll report back once that occurs. Essentially, it seems like a lot of time has been taken up on the state level with the budget and everything else. So status quo, no report.
Okay, thank you. Communications, Karen Braun, right here. All right, disaster planning coordinating, Kevin O'Hara.
As you previously reported, the disaster plan had been broken up into 4 different training modules: operations, provider, command, and communications. I'm happy to report that 3 of the modules are complete. By complete, I mean the PowerPoints have been written and the audio override has been made on it. So right now it's ready for publication. Our plan is to send that over to the REMSCO website, where through some computer magic, it's going to be placed on a YouTube video, but also the Department of Health. And we've been testing that over the last month and a half, putting on the learning management system. This way, anybody, that wants to take it, okay, can apply online, take it, and actually free of charge, hear it, and CMEs will be issued for it. So hopefully next meeting, I'll be able to say that's done and over, those 3. But we still have 1 piece left, the communications piece, very important piece. That is about 75% written. And when that gets written, I'm going to be talking to our police and fire communications people with the possibility that tired of hearing Kevin O'Hara's voice, okay? And by the way, it's open to anybody that wants to do this. So if you listen to this and you're tired of hearing me, feel free to override it and we'll get that published, okay? But I just want to make sure we move on it, because really enough time's been spent on it. It's very important, policy, and we need to get it out. So hopefully next month I'll be able to finish that.
Good job. All right, thank you very much. Education and training.
Not here.
Excuse. All right, legal and governmental affairs, Frank DeBovis.
Okay, on the legal and governmental affairs, first thing is, if anybody wants to join the legal and governmental affairs committee, let me know, because we have some work that we have to finish up, and I'd like to have several sets of eyes looking at everything.
Public education awards, dinner planning, Frank.
Okay. Public education awards, gonna read off the EMS Clinical Partner of Excellence is gonna be Tammy Haber from Northwell. EMS Agency of the Year paid is Nassau County Police Department, Emergency Ambulance Bureau, and EMS Agency of the Year volunteer is Seacliff Fire Department, with an honorable mention of Jericho Fire Department and Wantua Levittown. Basic Life Support Provider of the Year is Caitlin Carey of Wantua Levittown, honorable mention Dan Cuomo, Bethpage. Advanced Life Support Provider of the Year, Nick Pignataro, NCPD EAB, with honorable mention of Scott Costelin, Wantua Levittown, James John McGuire, Jericho, and Mike Schwartz, Nassau County Police EAB. Youth Provider of the Year is Vindu Kumar from Belmore Merrick EMS. The Harriet C. Weber EMS Leadership Award is shared, and it's going to be Dave Outlaw, my left. North Belmore Fire Department and the FPA, and Chris Pelock, retired. He just retired, Nassau County Police EAB and Farmingdale Fire Department. Honorable mention is going to Laura Agati of New Hyde Park. Catherine Lee of South Farmingdale Fire Department, and Irene Sabatosa of Wantua Levittown. EMS Educator of Excellence, Ryan McAvoy, NCPD EAB, and teaching up in the FPA. Richie, what's Girk, Northwell, Emergency Medical Institute, and Kevin O'Hara, Nassau County Police, Fire Police Academy, sorry, honorable mention. Physician of Excellence, Dr. Silver, Belmore Merrick Medical Director, Glen Cove EMS Medical Director, and Glen Cove Hospital. Honorable mention, Dr. Tim White, Northwell, and Neil Escapta, Medical Director, Nassau County Fire Police Academy. Innovation Award category is Dr. David Kugler and Dr. Joshua Kugler. EMS Nurse of Excellence is Kerry Smith Northwell, and she's also with the East Rockaway Fire Department. EMS Active Bravery is going to Elizabeth Adele, Ashley Vacone, and Mark Evans, Nassau County Police EAB. And that's the awards we'll be submitting this year.
Yeah, I think, well, just so you know, we're looking at a date, probably late September-ish for an award center. We're just gonna find out what's available, and you report back next month if you, when you know.
Well, we
about
can
it.
pick something. I got.
You know what's available?
I'm sure it's during the week, so it's easy.
Yeah, so I mean,
So for Wednesday or Thursday,
Right.
16, 17, 23, 24, or 30.
23, 24 would be better, give us more time after the September meeting to get tickets sold and everything, so that would be ideal.
All right, so I'll go and find
All
out.
right, thank you. Systems Committee, Chris Airy.
The Systems Committee is voted unanimously to approve the Woodmere Fire District request to move from number 3 to number 2 position in the 911 ambulance response matrix. We will be submitting that as a seconded motion to the council. We had an ongoing dialogue with the Woodmere Fire District regarding their desire to improve their response as well as their dispatch policies and how it relates to coordination of regional resources. The dialogue was excellent, and on further review, we reviewed their operation and approved that.
Thank you. Membership, Lena next.
Nothing to report at this time.
Okay. Hospital Emergency Department, Mary Gracer.
Nothing to report at this time. Not related.
Welcome aboard. Airway Committee, Dr. Newberg.
Hi, everybody. So, also for new business today, basically, it's been the standard of the Airway Committee that anytime we're credentialing new providers, that the physician from the agency is there in order to, to support their providers and also to answer any questions. That has been our policy since we started, but it wasn't written in the policy manual. So we've just asked for a line to be added to the policy manual to reflect the way we've been operating this entire time. Also, just as an aside, the state it had some discussions with Suffolk County about the way they were credentialing people, and the fact that the physicians weren't there was problematic. So the fact that we're doing that actually is in alignment with what the state is looking for. So we've been doing a good job with that from the beginning. So we're just adding that line in there under new business to reflect how we've been operating. Also, the recommendation from the Airway Committee is that if an agency is going towards video laryngoscopy, that we recommend that it records the event. It's important that the medical director of that agency has it part of the quality assurance plan, that those recordings are quality assurance only and only to be viewed by the medical director. That way, it remains confidential and not discoverable, and it's allowed then to be used for educational purposes and for quality assurance. That eventually will be the standard. It really does help a lot in trying to do education and quality assurance to see what the medic is seeing it during the time of the intubation. So that's definitely the right recommendation. So that comes from our committee. Yeah. I'm also doing Dr. Silver's.
I was gonna say quality committee.
Yeah, so Dr. Silver, yeah. Unfortunately, Dr. Silver had to step out and for family obligations, but he asked me to give his report. So from the and also this makes sense because the Quality Assurance Committee, Airway is technically a subset of that committee. So Dr. Silver and I have aligned pretty much the way our committees are operating, so it's uniform, and that's been working pretty well. So the first item from Quality Assurance is that there are no official psych receiving hospitals in Nassau County. So basically every hospital in Nassau County is able to take emergency psychiatric patients. So it's up to the provider discretion, closest and most appropriate available hospital, but there's no specific psych hospitals like there are trauma hospitals or stroke hospitals. So it's up to the individual provider, and that also the ED committee, once we have some meetings again, we do want to bring that back to the ED committee just to further that discussion, but that he will coordinate that with you, Mary, just so you know, moving forward. The second is that EMTALA, that is the federal law that basically prevents patient dumping. The idea is that if a patient goes to an emergency department, they need to be medically stabilized before they can be transferred. It's not an EMS law, but just so EMS is aware, if for some reason you are on the property of a hospital and you receive a 911 call, you need to transport that patient into the emergency department of that hospital for a medical screening exam before they could go somewhere else. Otherwise, while it would not affect EMS, the hospital could be fined for an EMTALA violation for not doing a medical screening exam. Basically, the law says within, I think it's 300 or 400 yards of the hospital. 50 feet, okay. 250 feet. So there's
250 yards.
Oh, yards. Okay, so it's 250 yards. So within that facility, 250 yards, that's considered hospital property, and then that patient has to go into the hospital for a medical screening exam. So that's not something that EMS would know, but there were a few cases that came across QA where that had been an issue. So we just want to make sure we educate everybody on that. The third thing is that QA is going to be meeting with the stroke coordinators. Remember, we did the change to go back to the Cincinnati stroke scale. They're going to be following up with that to see if that's getting the stroke coordinators better data. And then finally, just making sure to understand that frequent utilizers of the system can still have medical emergencies. So just to be sure that every time you contact someone to do a full assessment, that's important regardless, to make sure. And just know that quality assurance is looking for educational opportunities, and that if any case gets referred to the QA committee, it's never punitive, and it is meant to improve the system and improve education, and to make sure that as a system we're providing the best care possible. So that's Dr. Silva's report, and I will get back to you, Mr. Chairman.
Thank you.
You're welcome.
E-Bridge, Dr. Hoover.
There's no significant changes or updates at this time. We're trying to start a discussion. I think this was brought up a year ago. It's now getting more legs to bring the system to Suffolk County as well, so that the Suffolk County agencies and Nassau County agencies could be on one E-Bridge system. So if you're transporting from Nassau into Suffolk or Suffolk into Nassau, you just use the one system and everybody can see it. So we're waiting to meet with the Suffolk colleagues to sort of work out what they need to do. and with general devices. So that we could work out how to best to do this. But it's only update.
Thank you. The REMSCO REMAC EMS modernization tag.
So the state brought out new regulations about having to put a plan together, but they haven't sent the policy statement yet. So we're waiting on the state's guidance on how to proceed, and then we will then get the committee back together to review and discuss.
Sound good. Old business, we had the transfer operating authority with ES to CHS, that was completed. Any other old business? Discuss. New business, we have the edits to the policy manual. Second motion from REMAC, so if I can get a motion to step forward. Dr. Griffiths,
Second.
seconded?
It's seconded from me.
Oh, second.
So you gotta take the vote.
Okay, vote, okay, we do a voice vote? Yeah. All in favor? Aye. Any opposed? All right, the motion carries. From
Thank you,
the
everybody.
Systems Committee, we have the Woodmere Matrix upgrades. Second motion from the Systems Committee, do I have, I guess, all in favor? Aye. Any opposed? All right, motion carries. Do we have any other new business?
Yeah, Mr. Chairman. So, I'd like a policy addition to the Nassau County Policy and Procedure Manual. Over the last couple of months, I've had situations where I've responded to scenes where providers were not readily identifiable. And it can cause some problems. New York State has a policy 24-06 that says providers, agencies and systems share are encouraged to have a policy that governs the proper identifications of members, employees while providing care or while responding. What I'd like to have is our policy and procedure manual mimic the New York State policy. So it has a little bit more bite, so that our agencies in Nassau and our providers will be readily identifiable. When you walk up to a scene and there's 10 people standing there and half of them are wearing civilian clothes, who's the providers? It can be a challenge, especially when you have a critical patient. And are those people standing in the way? Should we say, hey, get out of the way? Or obviously more nicely than that, or are they actively providing patient care? I think it would be benefit more the patient than us, but nonetheless, it would benefit everybody if our providers were readily identifiable. So I'd like to make a motion that we add the same policy to the Nassau County Policy Procedure Manual.
I'll second the second. All in favor?
Aye.
All right. Any opposed? All right.
So just procedurally, we'll draft that for the next meeting,
Right, and then,
or you just wanted,
well, they'll draft it the next meeting, we'll put on a final draft.
Great.
Yeah,
awesome.
thank you. Any other new business? Any public comments? Good welfare. I just wanna bring up, we lost a valuable member of the EMS community, in the last month, Helen Freeze. Was, just, dynamic in everything she did. So, just like to mention that. Any other good welfare for the committee? All right, announcements. Next meeting is, June 3rd, 1400 hours at the Nassau County Public Safety Center here. Do I have a motion to adjourn? Dr. Pearson.
So we have a question.
Oh,
Yeah, that's the REMAC meeting.
Yeah,
Well, we did.
so the somehow the REMAC and the REMSCO meeting are on the same day. Do we want to do a joint meeting?
yeah, we will know. Can we do a joint?
Why not? You're the chairman.
Don't you
Yeah,
want?
I'm asking.
Yeah, yeah, sure.
As the REMAC chair to the REMSCO chair, would you like to do a joint meeting, sir?
We'd like to do a joint meeting.
Okay.
It'll be a joint meeting next one.
Okay,
All right.
Excellent.
done. There you go. So June 3rd will be REMSCO and REMAC.
There you go.
And food and beverages will be provided by the doctor.
Oh, wait, you can't do that anymore.
And libation.
Wait. All right, so I do have one motion to adjourn. Do I have a second? Second. All right, all in favor? Thank you for coming.
Thank you.
About closing on you.